Have you ever wondered what a stroke is and why it's such a life-threatening situation? We often hear about strokes in hushed tones, usually followed by a grimace or a shake of the head. It's something most people don't want to think about, yet it's crucial to understand. A stroke is a medical emergency that happens when the blood flow to a part of your brain is interrupted or reduced. This might sound simple, but the consequences can be devastating. Without blood, our brain cells can't get the oxygen and nutrients they need to function. It's like a car running out of gas, it simply can't go on. But unlike a car, our brains can't just be refilled and restarted. When our brain cells start to die from a lack of blood, it leads to brain damage. This can result in disability, or in the most severe cases, death. Just imagine one moment you're enjoying the sunshine, sipping your morning coffee, and the next you're in a battle for your life, all because part of your brain isn't getting enough blood. It's a silent, unseen threat that can strike at any time. Now you might be wondering, how does this happen? Well, there are two main types of stroke. Ischemic, caused by a blocked artery, and hemorrhagic, caused by a leaking or burst blood vessel. In both cases, the result is the same. Brain cells deprived of blood start to die. The effects of a stroke depend on the part of the brain affected and the amount of damage caused. It can impact everything from your ability to move and speak to your memory and emotions. It's a bit like a power outage in a city. When the electricity is cut off to a certain area, everything in that area stops working. But here's the most important part. Time is of the essence when dealing with a stroke. The sooner medical intervention is sought, the better the chances of recovery. Every second counts. Now that we know what a stroke is, let's dive into what causes it. What causes a stroke? The answer may surprise you. Strokes are primarily categorized into two types, ischemic and hemorrhagic. Each of these has distinct causes and effects, and understanding these can be a major step towards prevention. Let's start with ischemic strokes. These are the most common and account for approximately 80% of all strokes. They occur when a blockage or clot forms in the blood vessels that supply blood to your brain. Imagine a bustling highway suddenly blocked by a massive traffic jam. The cars, or in this case, the blood cells, can't get through, which starves the brain of the oxygen and nutrients it needs to function. The result? An ischemic stroke. On the other hand, we have hemorrhagic strokes. These are less common, but typically more severe. Here, instead of a blockage, there's a breakage. A blood vessel in or around the brain bursts or leaks blood. This bleeding can cause swelling and pressure, damaging cells and tissue in the brain. It's like a water pipe bursting in a house, causing water damage and structural issues. However, strokes don't just occur out of the blue. Certain risk factors increase the likelihood of experiencing one. High blood pressure, for instance, is a leading cause. It's like turning up the pressure in that water pipe we mentioned earlier. Eventually it might just burst. Smoking, obesity, high cholesterol, diabetes, and heart disease are all significant contributors too. Each of these factors can damage or put stress on your blood vessels, making a stroke more likely. It's akin to neglecting the maintenance of that house or highway. Eventually problems are bound to occur, so understanding the causes of stroke and recognizing your risk factors is invaluable in preventing this potentially devastating event. It's about keeping that highway clear and the house well maintained. Identifying these causes is the first step in prevention, but what happens when a stroke occurs? Now that's a question worth delving into. Time is brain. Recognizing the signs of a stroke could mean the difference between life and death. A stroke is a medical emergency and every second counts. That's why it's vital to recognize the symptoms as quickly as possible. One easy way to remember the most common signs of a stroke is the acronym FAST. Let's break it down. First, we have F for face drooping. This is one of the most noticeable signs of a potential stroke. If one side of the face is drooping or numb and the person's smile appears uneven, it could be a warning sign. Next, A stands for arm weakness. If the person is experiencing weakness or numbness in one arm, ask them to raise both arms. If one arm drifts downward, it's another possible indicator of a stroke. Then we have S for speech difficulty. Is the person's speech slurred? Are they unable to speak or hard to understand? Ask them to repeat a simple sentence. If they struggle with this, it's time to take action. Finally, T stands for time to call emergency services. If someone shows any of these symptoms, even if they go away, call for help immediately. Remember, time is of the essence. But these aren't the only symptoms to watch out for. Other signs can include sudden confusion or trouble understanding speech. The person may also have difficulty seeing in one or both eyes. Difficulty walking, dizziness, loss of balance or coordination are also potential warning signs, and let's not forget about severe headache with no known cause. It's important to understand that these symptoms can occur individually or all at once. They can be subtle or come on suddenly. But the key is to act fast. Reacting quickly when these symptoms occur can save a life. But what happens after a stroke has occurred? Strokes are serious, but with rapid treatment and comprehensive rehabilitation, recovery is possible. When it comes to a stroke, every second counts. The sooner you receive treatment, the better your chances are of minimizing brain damage and potential complications. Let's start by talking about clot-busting drugs. These are often the first line of defense when it comes to treating a stroke. These drugs work by dissolving the clot that is blocking blood flow to the brain. The most common of these is called tissue plasminogen activator, or TPA, which can be given within 4.5 hours of the onset of stroke symptoms. Sometimes, clot-busting drugs might not be enough, or they might not be suitable for some patients. In such cases, surgery may be necessary. A procedure called a thrombectomy can be performed to remove the clot. In this procedure, a catheter is threaded up through an artery in the groin to the blocked artery in the brain. The clot is then physically removed. Once the immediate danger has passed, the recovery process begins. This often involves rehabilitation therapies designed to help regain strength, coordination, and function. Physical therapy focuses on improving physical abilities and motor skills. Occupational therapy helps patients relearn the skills needed for daily living, such as eating, dressing, and bathing. And speech therapy assists patients who have trouble with language or swallowing. Let's remember, though, that every stroke patient is unique. The road to recovery can be long and challenging, and it often requires a team of dedicated healthcare professionals. It's also important to note that the recovery process doesn't stop when you leave the hospital. Many stroke survivors continue therapy for months or even years after the event. The goal of all this treatment and rehabilitation is to help stroke survivors regain as much independence as possible and improve their quality of life. It's a tough journey, but with determination, perseverance, and the right support, it's a journey that many have successfully made. Treatment is crucial, but remember, prevention is better than cure. So what have we learned about stroke today? Stroke is an unseen threat, a medical emergency that occurs when the blood supply to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. This is a serious condition that requires immediate medical attention. We delved into the underlying causes of stroke, which include high blood pressure, tobacco use, diabetes, and obesity. These are all factors that can increase your risk, but remember, anyone can have a stroke. It's not limited to people with these conditions or habits. We also discussed the critical importance of recognizing the warning signs of a stroke. The quicker you can identify these signs and seek help, the better the chances of recovery. Remember the acronym FAST. Face drooping, arm weakness, speech difficulty, and time to call emergency services. These are the key signs that someone might be having a stroke. When it comes to treatment and recovery, we learned that it varies greatly depending on the type of stroke and the amount of damage done. Treatments can range from medication to surgery, and recovery may involve physical, speech, and occupational therapy. The sooner treatment begins, the better the chances of minimizing brain damage and potential complications. We've covered a lot of ground today, but the key takeaway is this: understanding what a stroke is, knowing its causes and symptoms, and recognizing the urgency of seeking medical attention can make all the difference. It's about being aware, being prepared, and acting quickly. Remember, knowledge is power. Understanding strokes can help you protect yourself and your loved ones. Stay safe and stay informed.